fibrosis, including bridging fibrosis in some patients, completely disappear. So this leads hepatologists around us to think of this disease as a new disease. It's an orphan disease without treatment in the most severe cases, including some patients with cirrhosis, to be proposed for surgery. So that's an example of new indication that can come in the future, which realistically can be envisaged because there is no treatment, unlike recent onset diabetes. So now, mechanism of action. Of course, if we want to convince our colleagues that surgery is an option and is a correct answer to this disease, we need to have a mechanism. It's very difficult to explain them that it's a magical operation, and we can do many, and it's always working. So there is many literature, a lot of literature, you know that, and this is just a review we published 2 years ago about what was known. Of course, caloric restriction and weight loss is a major point, but others candidates are there, and we know that hormone and GLP-1 has been studied extensively. But recently, it became obvious that non-weight-independent mechanisms related to the intestine may be involved. And this is just 3 recent studies in the rodents that were published in big journals that just tackle microbiota, you know, the microbes that are into your intestinal tube that are changed after surgery, that could affect metabolic disease. Bile acid is a very recent candidate, but it's on the iron list. And glucose intestinal uptake is also the third mechanism that is exclusively devoted to intestine, so no pancreas involved, no insulin resistance, just the intestine. So this new mechanism could explain part, or at least most, of the weight-independent mechanisms. So of course this is rodents, and we need to now speculate, but we need also to go forward. And I think that large animal models are important, essential on the pathway to go toward clinic and to better understand it. Because we are very limited to reproduce surgery in the rodent, because it's very small, difficult for anatomical reasons. Physiology is very different. When in some other animals, like large animals, like mini pig, which is a small pig, they can be maintained chronically, and of course primate, but it's difficult to maintain primate, as you know. But these animals will certainly be crucial in the coming decade to decipher and to more precisely explain and understand why surgery works and which is important in surgery. And we recently published a model with a reproducible, including hormonal secretion, phenotype after gastric bypass in the mini pig, which mimics the human situation. So of course now that leads us to new interventions, because these mechanisms will lead us to better understand and to propose maybe different, maybe less invasive operation, maybe part of the operation. And of course we have to be very careful of safety when promoting these new operations. An important point here is that of course some operation may look less invasive, but a recent article that was published in the New England stressed that safety in surgery relates mostly and very, very strictly to experience, meaning that a new operation like sleeve gastrectomy seems simple, but it's a good answer if the question is good. If the question is just gastric bypass is too difficult, it's too dangerous, I don't know how to do it, or I don't know how to do that, and so I will do a simple one, this is a bad answer. You can see here that at least the surgical skills are responsible to increase by 3 times the risk of complication, including reoperation, including readmissions in this article, in the gastric bypass, for example. So we have to be very careful to separate or decipher the procedure, but also the skills of the surgery, the skills of the team, the skills of the follow-up. These all aspects are very important to ensure safety. So now we are, of course, embarking into a new era of less invasive surgery, or less invasive intervention. Some of them will be performed with gastroenterologists, hopefully together with bariatric surgeons. This is, of course, the most known one. We have been testing that for now 2 years. We produced the results that were published, at least partly. We have also seen some complications, not severe ones, but it's, of course, not